Angie Technologies is presenting the SU-VEID, a vein indication device for a better therapy. The SU-VEID is enabling you to perform the perfect IV insertion with success in first stick. First time every time. The SU-VEID is integrated to the IV catheter and is intuitive to use. The SU-VEID signals to you by an audio beep and light, when the needle is inside the vein, bringing you the sound of success. Pull out the strip to activate the SU-VEID and start the insertion process. Once the needle punctures and enters the vein, a beeping signal is activated instantly, and preventing double puncture. But if the needle exits the vein, the indication ceases. You then pull back, until the indication resumes. While continuously receiving sound and light, lower the IV catheter to the desired angle. The signaling momentarily ceased, while pushing the cannula forward, and resume in a half-detached state, allowing now the safe completion of the insertion. Notice: in a traditional cannulation, the blood flashback is delayed to an unknown extent, due to multiple factors. During this delay time, the needle occasionally exits the vein. This means that often, when you first see the blood, the needle had already perforated the opposite wall of the vein. And once the flashback chamber is filled with blood, there is no reliable indication of catheter location, because the blood is in the flashback window, anyway. The SU-VEID, using advanced technologies, senses the tissues and blood pressure when needle is in the vein, bringing you the location indication throughout the procedure. Using SU-VEID eliminate risks, at any given moment you experience, hearing the sound of success. Perfectly distinct whether you are out or in, relative to the vein. Designed to avoid infiltration of medication by signaling you to return the needle safely, back to the vein. Here is how a half-detached feature assists you. When the cannula is pushed forward along the vein, the sound and light will momentarily cease, for as long as the cannula moves forward, and resume in the half-detached state. A feature, confirming that the cannula is well situated in the vein and the procedure can be completed successfully, and the needle can be pulled out. SU-VEID, the sound of success. Differentiate in from out of vein. In a real-time response, SU-VEID, integrated to the palm of your hand and puts the focus where it should be, the anatomy, and the patient.